Hey there. So let's talk about heart murmurs. I'm somebody who is all about finding some sort of pattern to things. So I was able to figure out a way to kind of make a table so that it's really easy to just jot down and then look at on your piece of scrap paper. So phys questions and all that on heart murmurs are way more straightforward. Also for pathology for heart, if you know the murmurs, it makes those path questions significantly less hard to answer. So I'll show you my method. So what I do is I draw this square, and you want to put 3 columns and then 5 rows. Label this one holosystolic, so all of systole, otherwise known as pansystolic, systole, and diastole. And just as a reminder, this is S1 and this is S2. Well, both of these will be S1 because they are systole. As a reminder, if you're looking at a person, you're going to have all patients teach me. All patients teach me. That's the way to remember it. So that's going to be at the second intercostal space on the right will be the aortic, or the best place to hear the aortic valve. Second intercostal on the left will be the best place to hear the pulmonic valve. This star right here is the area that's referred to as the left sternal border. The T is the tricuspid valve, otherwise called the left lower sternal border. And then you have this M right here for mitral valve, and that's best heard at the apex or the fifth intercostal space at the midclavicular line. There's different names for these. Another rule of thumb is regurgitation will be high-pitched sounding and a blowing sound. So high-pitched and blowing, regurg happens when the valves are supposed to be closed. So if you think about it, regurgitating food or something like that happens when you eat something, it goes down to your stomach, something wrong happens, and you regurgitate it back up past the lower esophageal sphincter, past your whole throat situation, and out of you. So what should have been closed is open, and you're able to regurgitate through your mouth. So it's the same thing with the valves. Regurg will sound high-pitched and blowing, and they happen when the valves should be closed. Stenosis is happening when the valves are normally open, but they have a much more narrow opening, which is stenosis. So that's something to just keep in the back of your head. All right, so remember looking at these A, P, T, M, and the star. So we're going to put that on the left side. So all patients star teach me. It's a nice positive mantra too. So after you draw those in, then I like to put in the number of murmurs. So you have 1, 1, 3, it's the third spot, 4, it's the fourth spot, and then you're back to 3 for the mitral valve. Next, you eliminate the areas where you do not have a murmur, and then you start putting them in. So I normally put systolic sounds with pink. So A1 means that there's going to be one murmur, there's only one spot. So it's going to be aortic stenosis. Same for the pulmonic valve, pulmonic stenosis. These two guys go together and these two go together. So you'll always have stenosis in either systole or diastole for these pairs, and the opposite for systole or diastole for regurg. Okay, and then now that we're at the star, so this one's going to be hypertrophic cardiomyopathy. So this has 3 letters, and it's in the middle. And later you'll see down here 3 letters, so 3, 3, 3, 3, and they're both in the middle. But we'll get there. Okay, and then for diastole, we have the systolic stenosis of these two. So they need their regurg. Since it's not going to happen in systole, it'll happen in diastole. So for this 3 right here, we already got one of them, so we have 2 more, that will be at the left sternal border. So that will be aortic regurgitation and pulmonic regurgitation. Now going down to the T4 and the M3. I start at the M because it's just easier for me. So I remember the M lines as Mr. and Miss and their most valuable player, MVP. So MR is going to be mitral regurg, MS will be mitral stenosis, and MVP will be mitral valve prolapse. So now that we know that the R is here and the S is here, it's an easy way to know that, make that blue. It's an easy way to know what the T tricuspid area is doing. So TR, because those are always paired together. And then in the blue, TS, paired together. Notice R for these two, S for these two, and then vice versa for systole. Okay, but we still have two more that we need for the tricuspid because there's a 4 there. So that's where we put ventricular septal defect. And if we have the ventricle, then we're going to need the aortic septal defect somewhere. So that goes on this side. So now that you have those, what I like to do next is put in their style of sound. So you have crescendo, decrescendo sounds for these two. And as a reminder, that's where it goes up and then down. Crescendo, decrescendo. That's where it's called like a diamond shape. There's only 2 of those. Then you have one crescendo, which happens to be in the center. So that's kind of an easier way to remember that. And then you need a decrescendo. So there's actually 2 decrescendos. There's going to be an early decrescendo and then middle to late decrescendo, but usually it's called late decrescendo. So I label those as D1 and D2. D1 meaning early, D2 meaning late. They just happen to be in diastole as well, so it's decrescendos in diastole. Okay, next is where we use emo. Emo. What does that mean? Well, they stand for the weird sounds that happen in the middle of some of these. So you'll have the E for ejection click, the M for mid-systolic click, and then the O for opening snap. Emo. Okay, then after that, I like to put the quality of the sound. So aortic stenosis will be harsh. And ventricular septal defect will also be harsh. And then for all of the regurg, as we talked about earlier, it will be high for high-pitched and blowing. So this one will be high. And then you also want to put in rumbling. So that will be for mitral stenosis. So you can think of this miss over here loves her rum. Oh, yes, she does. Okay, and then there's actually one more murmur that I didn't include, which is patent ductus arteriosus, PDA. The reason I didn't include it is because it's actually all of systole and diastole. It's continuous. And how it's described is a continuous machine-like murmur. So this is best heard at S2 because that's where it's the loudest. During S2, excuse me. And that will be at the left infraclavicular area. So PDA, definitely know that one. Actually, keep this going. Okay, so after that, I like to add a little bit more detail on where things are going. So mitral valve prolapse can eventually lead into mitral regurg. Mitral regurg will radiate to the left axilla. So if someone has a murmur and they have this pain that radiates to the left axilla, probably going to be mitral regurg. And then for atrial stenosis, that's going to radiate to the carotids. And just as a reminder here, another way to describe the area that they're at is the base of the heart. This is the left sternal border. This is the lower left sternal border. And this is at the apex. So definitely good to be familiar with those. And that's basically it for drawing out this so that you can easily refer to it during your questions on your exams. I hope you find this helpful.